Continuing our coverage of living with Alzheimer's, with a disease that affects around 6 million Americans, doctors say it's important to watch out for early signs of the disease. Our own Joshua Blount spoke to an expert in the field and broke down the signs you should watch out for.
Alzheimer's is a disease which normally affects people 65 and older.
It causes a loss of cognitive function. Initially, that is usually memory and visuospatial orientation that goes along with it, and sometimes some language difficulties, and then it progresses to where they are unable to care for themselves.
MU Health neurologist Dr. David Beversdorf has studied Alzheimer's for more than 20 years. He says behaviors which may indicate a possible problem can pop up in day-to-day activities.
Significant memory difficulty is usually the first sign. And so a person that begins to repeat themselves quite a bit, that's often one of the first signs. And visuospatial orientation is also a problem. They get turned around and lost much more easily.
Dr. Beversdorf says other signs could be more serious.
That could advance to not being able to drive because they can't find their way home, and language difficulties as well. And so if they're having an excessive amount of trouble coming up with words, more than typically should be expected with age, then that's a concern.
While there are clinical tests, Beversdorf says a family opinion may just be as credible as a test.
If there's a very engaged family and they say something's not right with dad or mom, the odds are they're correct. I find the families report to be more correct than some of the screening tests.
Beversdorf says there is currently no cure for Alzheimer's, but says there are several drug treatments that have been around for at least 20 years, including donepezil, rivastigmine, galantamine, and memantine. Beversdorf says finding a cure will be life-changing for millions of people.
If we can find a treatment that helps, this is going to be really, really big. But we're still waiting and still hoping.
Beversdorf says the first FDA-approved drug, aducanumab, addresses the underlying biology of the disease and got provisional approval with only one positive study. However, Beversdorf says he has faith the most recent drug, lecanemab, could be life-changing.
The new drug apparently has 2 positive studies, both on clinical outcome. The second study is the big confirmatory study. We only have a press release, so we can't look at the details, but it did show an effect on its primary outcome measure.
The results of lecanemab are scheduled to be published in the upcoming months, but according to developers, patients taking the drug showed a 27% decrease in cognitive decline compared to the control group. Reporting from Columbia, Joshua Blount, ABC 17 News.
The Alzheimer's Association says long-term care for someone with the disease can range from anywhere from $50,000 to over $100,000 a year, depending on the type of care that best suits your needs. And on Sunday, ABC 17 News will be walking in support of the Alzheimer's Association in Jefferson City. If you'd like to donate or sign up to walk, you can scan the QR code on your screen right now. Make sure to follow along all week for our continued coverage in our Living with Alzheimer's segments.